Okay, let Shubhadeep join. Then we can start. This is a problem with Google Meet. So today we will actually be talking about hypersensitive reactions. So hypersensitive, I'll share my screen. Is the screen visible?
Yes, sir.
Hypersensitive reaction. Are you able to see this hypersensitivity reactions?
Yes, sir.
Okay. What about Shubhadeep? Is he not able to join? এই শুভজিৎকে একবার ফোন করে জয়েন করতে বলো। তুমি কিছু বানাচ্ছ নাকি? পুরা বন্ধ একটু। ওকে। আমি দাঁড়াও দেখি শুভজিৎকে একটা ফোন করি। জাস্ট হোল্ড অন।
স্যার জয়েন করে গেছে।
ও জয়েন করে গেছে? আচ্ছা। শুভজিৎ হ্যাঁ ওকে শুভজিৎ জয়েন করে গেছে ঠিক আছে ফাইন সো today we will be talking about hypersensitivity reactions and it is my firm belief that in this semester that there definitely is going to be a 5 marks question from this because this is a very important topic. The first thing which will come to our mind whenever we think about hypersensitivity reaction is allergy. When some people are allergic to eggs, some are allergic to prawns. There are many. I am allergic to many things, many substances like jalapeno on pizza. That green thing which they give, jalapenos. I am very allergic to it. Immediately, I get anaphylactic reactions in my body. There is a swelling, edema, and my immune system doesn't take to is very much sensitized. So some people they are that there is an allergy for no reason at all. Something is coming in my body, and against that my immune system is reacting. This is not a very happy situation to be. So those people are told to uh, avoid those food stuff, but they may like this food stuff. Some people are allergic to brinjal. Even immediately after taking brinjal, they'll see that there'll be an itching sensation inside their mouth. Then they may feel like vomiting. So these are essentially your immune system is rejecting these particular food materials. So these are hyper. This can be severe. Sometimes even allergies can lead to death. So therefore, there has been a lot of studies on allergy. Why this takes place? Why does this allergy happen? Nobody knows. Many people are allergic to pollen grains. Especially one of the biggest dangerous pollen grains are the Parthenium pollen grains. Have you people heard about Parthenium?
Yes, sir.
Yes,
With
sir.
Parthenium, the moment wherever try to avoid it because this Parthenium, the flower allergy, as such, it is harmless. The nice little white flowers, but that is
Sir.
one of the nice little white flowers these Parthenium have, but problem with it is it looks nice. I used to put but this is one of the major things for people getting asthma because this asthma is also a sort of immune react. Your immune system is reacting to something from outside, some pollen grains. Asthma can lead to death also. Among mucus jome jabe, your lungs will not be able to breathe. আচ্ছা, স্ক্রিনটা এখনো দেখা যাচ্ছে তো?
Yes, sir.
ওকে,
Yes, sir.
ওকে। So basically, immunity means what? It is protective, and its function is to overcome infectious agents or antigens and certain toxins, bad things. দাঁড়াও দেখি কে আসছে। There is a sound here. You're presenting to everyone. Everyone, it's fine. Why is this sound? Okay. So, but at times this immune response, it may also be injurious to the host, and sensitized individuals respond to specific antigenic stimuli in an inappropriate or exaggerated manner. What are sensitized individuals? Sensitized individuals are individuals who are sensitive to a particular antigen. But say, whenever you take a prawn or brinjal, suddenly you may find that you are having an allergic reaction, and that thing, whenever is getting inside your bloodstream, immediately you have sorry, your immune system is acting in a very exaggerated manner. Normally you're taking it, normal people are taking it, no problem, but when you are taking it, you are having a lot of big problem. So you are a sensitized individual. They are very sensitive to that particular antigen, particular food, especially food, or sometimes some people get asthma very quickly. Immediately, pollen grain goes inside the lungs of many of us. Nothing happens basically. Suddenly, few individuals, immediately there is a reaction and they are unable to breathe, and they have got a big problem, bronchitis, and then followed by asthma. Yeah, especially in hilly areas, some people have developed asthma very fast because of these particular allergic reactions. So these people, for them, it's a very bad problem. They must actually change the town or city in which they live. Okay. In the protective part of immunity, antigen is the focus of attention and what happens to it. So, what happens is how antigen, what is entering your blood, what pathogen is entering your blood. Pathogen with its shape is that antigen, what is entering your blood, and how your B cells and T cells and your innate immunity respond to it. That is what you study. Example, toxin is neutralized, bacteria is lysed by complement. All these things you have, we have learned about all these things. But in hypersensitivity, antigens are of little concern, and often innocuous or bland substances such as serum proteins or pollen, they become severe importance. Pollen নাক দিয়ে ঢুকে লাংসে গেল, immediately you are not talking about antigen or how the protective part happens. But what happens when certain innocuous, insignificant things, it is not very important, or bland substance, बेकार का एक पोलन घुस गया, immediately वो मरने के लिए चला. So hypersensitivity is concerned with what happens to the host as a result of immune reaction. So what happens to that sensitized individual because of that particular thing which has entered, how the immune system is reacting, overreacting rather, I would say. Little is known about hypersensitivity. Okay, the definition of hypersensitivity is, it is the injurious consequence in the sensitized host following contact with specific antigen. Sensitized host is the host which is sensitive to that particular antigen. And what is the injurious consequence which happens? And this hypersensitivity deals with injurious aspect of heightened and exaggerated immune response, leading to tissue damage, disease, or even death. Think about asthma. इतना immune response हो गया that so much mucus is in your lungs that your lungs are unable to take oxygen and you suffocate to death. And so it is a huge thing of study, and it is concerned with what happens to the host rather than what happens to the antigen. How the antigen is removed, that is not important. How the B cell and T cell is removing it is not important. What is happening to the host? कहाँ पे फूल रहा है, कहाँ पे उन लोग का सांस लेने में प्रॉब्लम हो रहा है, कहाँ पे खुजली हो रहा है हाथ में. Suddenly, after taking certain food, you see that mosquito bite and rashes come all over your body. You are scratching your whole body. It happens because certain things you are very sensitized against certain things. Your body, your particular body immune system is very sensitive to those things. So this hypersensitivity, it is dealing with the injurious consequences. Clear? Yes, no?
Yes, sir.
Okay.
Yes, sir.
So you are dealing with the injury, what the injurious consequences are. So what are the essentials for hypersensitivity? मतलब hallmarks of hypersensitivity. First is contact with the allergen. Allergen मतलब वही antigen, that pollen, or that something which is present in prawn which is causing your allergy. Next is sensitizing priming dose. The one pollen enters, maybe your body will not react, but 10 pollen enters, you are a sensitized host, your body is going to react to it. So that priming dose, first initial dose, then induction of AMI CMI, that is the first reaction which takes place. We will talk about AMI CMI later. And then you have the shocking dose, the one where the amount which really will lead to a consequence, that is known as the shocking dose. So the 4 steps of hypersensitivity. First is allergen ke sath contact, then the amount of dose, then then induction of the first allergic reaction, and then you have a shocking dose. You take say 10 prawns and then immediately you start choking to death. Immediately, whenever such a thing happens, you have to take an anti-allergic immediately. They will suppress your immune response for temporarily. Then you have, it's a classification of hypersensitive reaction. The first thing is traditional classification. And then in your syllabus, what you have is the Coombe and Gell 1963 classification. So the traditional classification, it is based on the time required for a sensitized host to develop clinical reaction on re-exposure to the specific antigen. So the traditional classification is based on time required. कितना time लगता है for a sensitized host to develop, मतलब clinical reaction is खुजली होने के लिए वो rash निकलता है on re-exposure. Second time जो dose expose हुआ, first time में AMI CMI होता है, and after second time is the shock. So the traditional classification goes according to the time required to show a khujli or show a breathing problem. Then you have Coombe and Gell classification. This classification is based on the mechanism of pathogenesis. Mechanism of pathogenesis is what is the mechanism by which the pathogen or the antigen or the allergen is causing the exact logic of why this particular damage is being done. So basically, Coombe and Gell classification is followed because time required, some people may take 10 hours, some people may take 2 hours. It is not very scientific. It is traditional. Former times, बोला कितना time लगता है वो particular खुजली होने में. Once you take a brinjal, what is the time taken for you to have a particular itching reaction? That was the former time. किसी का 10 मिनट, किसी का तुरंत. It depends on the time required by re-exposure. First बैंगन में कुछ नहीं होगा. First बैंगन में your body will get sensitized. CMI AMI बोलता है उसको. And then next what happens is that सेकेंड टाइम में सेकेंड जब बैंगन लोगे मुंह के अंदर तुरंत तो गला फूलना चालू हो जाता है, होंठ फूलना चालू हो जाता है. All these things can happen, but that depends on individual. But Kuhlman-Gell's classification is the mechanism of pathogenesis, whether it's a B cell response, whether it's a complement response, whether it's a non-specific response, whether it's a T cell response, the mechanism of pathogenesis. So Kuhlman-Gell's classification is more scientific, more accepted nowadays. But still you need to study about the traditional classification. First is immediate hypersensitivity, and that is basically on the basis of B cell or antibody mediated. You have anaphylaxis. Anaphylaxis means that a Y is missing. I missed out the Y over here. Anaphylaxis is without protection, without immunity. So basically swelling, खुजली ये सब चीज होता है. Atopy is stoppage. Then you have antibody mediated damage, arthus phenomenon, arthritis type of phenomenon. Then serum sickness. So certain patches come out from some sickness in your blood. These are the different types of reactions, hypersensitive reactions which take place. I will give you a list of what happens in each of these: anaphylaxis or atopy or antibody mediated damage or arthus phenomenon or in serum sickness. And you have the delayed hypersensitivity, like the infection tuberculin type, or maybe your COVID, 3-4 दिन में आता है. You get this hypersensitivity after a few days of COVID infection. Suddenly lungs में इतना mucus जम जाता है, you have a problem. Then you have the contact dermatitis type. Dermatitis, instead of A it has become S, dermatitis type. So contact means like eczema, all these things. Touch, eczema touch होता है तो then immediately it spreads. Contact हो गया eczema का. Some people get this eczema by touching. They are very allergic to it. So immediate hypersensitivity appears and recedes rapidly. आया और गया, like a mosquito bite. और delayed में धीरे धीरे आया और बहुत देर तक रहता है, lasts longer. Immediate hypersensitivity is induced by antigens or haptens by any route. Haptens, I've told you, basically they are not a problem. Haptens, they don't induce an immune response by themselves. But when they are adjoined with another compound, and this is injected in your body, a huge antibody reaction, immune reaction takes place. That is a hapten. Antigen or hapten intradermally or with Freund's adjuvant or by skin contact. By anything. Freund's adjuvant is basically the hapten when it is conjugated with an adjuvant that which induces the particular immune reaction. That is the adjuvant. So hapten, it can be a bovine serum albumin. To that, a small antigen which pollen or something which doesn't cause any reaction, suddenly it binds to this particular adjuvant, and then immediately you will find this particular immune reaction takes place. Or skin contact, touch hua, like eczema. Immediate hypersensitivity, circulating antibodies present and responsible for the reaction. So basically, it is an antibody mediated reaction. Here, circulating antibody may be absent and not responsible for the reaction. There can be a cell-mediated immunity taking place, like in eczema. Cell-mediated reaction. Cell-mediated is T-cell response. Then passive transfer possible with serum. Cannot be transferred in delayed hypersensitivity. It cannot be transferred with serum, but possible with T cells or transfer factor. There can be some transfer factor or T cell. Desensitize easy but short-lived. Desensitize means allergy कम हो जाना, खुजली कम हो जाता है, वो रैश चला जाता है, दैट इज डिसेंसिटाइजेशन. बट डिलेड हाइपर सेंसिटिविटी इज डिफिकल्ट. तुरंत एक एंटी एलर्जिक ले लिया एंड यू कैन नॉट स्टॉप इट. डिलेड हाइपर सेंसिटिविटी आता है बहुत देर से, लेकिन जाता है भी बहुत देर से. क्लियर? यस, नो?
Yes, sir.
Yes, sir.
Now then, Coombe and Gell's classification. So according to them, there are 4 types. One is the type 1, type 2, type 3, and type 4. First is IgE, immunoglobulin antibody E mediated. IgE mediated, B cell type. Then you have type 2. This is cytolytic and cytotoxic. The cell bursts and it is toxic for the cell in this hypersensitivity reaction. Type 3, an immune complex is formed. And in type 4, you get the characteristics of a delayed hypersensitivity. We will talk about these types of classifications in details. So type 1, we will see what is atopy and anaphylaxis. Atopy and anaphylaxis. Type 2, you have Arthus reaction, serum sickness. Type 3 में, type 2 में you have autoimmune anemia. साइटोलाइटिक होता है ना, हेमोलाइटिक डिजीज ऑफ न्यूबॉर्न, ग्रेव्स डिजीज, माइस्थेनिया ग्रेविस. माइस्थेनिया मसल के अगेंस्ट में एंटीबॉडी बन जाता है, ऑटो इम्यून बेसिकली. You need to give an antibody thing. Then type 4, you have contact dermatitis, tuberculin reaction, Schwartzman reaction. So these are all like eczema, long, hypersensitive, मतलब delayed response. So type 1, you have anaphylaxis and atopy. Time required for manifestation in minutes. मिनट्सों में होता है. उसमें क्या होता है, सर दर्द ये सब एक्सेट्रा हो जाता है. सडनली आफ्टर अ पर्टिकुलर स्मेल और सम कुछ खाने के बाद सर दर्द होना चालू हो जाता है. दैट इज बिकॉज ऑफ दिस IgE इंड्यूस्ड हिस्टामिन एंड अदर फार्माकोलॉजिकल एजेंट्स. तो तुरंत देन यू टेक कुछ एनासिन ले लिया या कोई एस्पिरिन ले लिया, क्रोसिन ले लिया, सर दर्द चला गया. दैट इज बिकॉज ऑफ दिस हिस्टामिन विच इज फॉर्म्ड, दैट इज रिमूव्ड. Type 2, antibody mediated damage, thrombocytopenia. Your thrombocytes, a component of your blood cell, they are attacking. Then blood cell burst हो जाता है, hemolytic anemia. ये वेरिएबल होता है, आवर्स टू डेज लगता है, कुछ घंटा में और कुछ मतलब कुछ दिनों भी लगता है ये होने में. The immunoglobulin responsible IgG, IgM, and factor C. There is a factor known as factor C. ये टेस्ट होता है एलर्जी का. टेस्ट में दे टेस्ट फॉर योर C. ये टाइप 1 है या टाइप 2 है, टाइप 3 है, दे C. टाइप 3 शोज आर्थस, आर्थराइटिस जैसे, अगेंस्ट योर जॉइंट्स ओनली. आर्थस रिएक्शन, सेरम सिकनेस. सेरम सिकनेस पे पूरा बॉडी में you will get red yellow rashes coming out. It is variable, hours to days लगता है. White blood cells are responsible. Factor C भी है, IgM भी है, IgG भी है. Then type 4, मतलब लॉन्ग डिलेड, बहुत दिन रहता है, बहुत दिन, 2-3 दिन लग जाता है, आवर्स टू डेज लगता है. ट्यूबरकुलिन टाइप, मतलब ट्यूबरकुलोसिस में जो होता है, योर इट हैपेंस इनसाइड योर लंग्स. और एक्जिमा में जैसे होता है कॉन्टैक्ट डर्मेटाइटिस. So T cell, lymphocytes are like cytokines by secreted by lymph cells. T lymphocytes secrete करता है. Then it is also secreted by macrophages. वो खुद macrophages अपने सेल को ही खाना चालू कर देता है. So type 1 is IgE dependent. Occurs in 2 forms. Anaphylaxis, तुरंत तुम्हारा हुआ एक्यूट, तुरंत खुजली आ गया या तुरंत तुम्हारा स्वेलिंग आ गया सब जगह पे. Acute, potentially fatal, and systemic form. It is in your through your blood, systemic circulation. And atopy, chronic और recurrent, बार बार होता है. इट इज नॉन फॉर फेटलाइज, मतलब बार बार तुम अचानक, मुझे पता नहीं, कभी कभी एवरी इवनिंग एक स्वेलिंग होता है, आई हैव अ स्वेलिंग, एंड दिस पर्टिकुलर स्वेलिंग और खुद आता है खुद चला जाता है, नो प्रॉब्लम एट ऑल, इट इज नॉन फेटल लोकलाइज्ड. सो लेट अस सी व्हाट इज एनाफाइलैक्सिस. तुम लोग को डेफिनेशन दिया है, बट स्टिल लेट अस सी द डेफिनेशन. So anaphylaxis, it causes the immune system to release a flood of chemicals that can cause you to go into shock. उसमें क्या क्या होता है? Blood pressure drops suddenly and the airways narrow, blocking breathing. Signs and symptoms include a rapid, weak pulse, a skin rash, and nausea and vomiting. I have already sent this in your WhatsApp group, this definition. Now let us see what is atopy. Atopy is a predisposition to an immune response against diverse antigens and allergens, leading to CD4, Th2, T cell differentiation and overproduction of immunoglobulin IgE. The clinical consequence is an increased propensity to hypersensitive reaction. So basically a T cell का जो response होता है, that happens. So it is already a predisposition. You are already sensitized. Predisposition पहले से ही your body is against this particular thing. The clinical consequence is an increased propensity. Then what is Arthur's reaction? So arthritis में basically होता है, the Arthur's reaction is a localized inflammatory response belonging to a typical local subacute type 3 hypersensitive reaction. So basically localized जगह पे you have an inflammation, like in arthritis, joints में inflammation हो जाता है. Clear so far?
Yes, sir.
Okay.
Yes, sir.
So anaphylaxis means without protection. Classical immediate hypersensitivity reaction. Sensitization. This is most effective when antigen is induced parenterally, मतलब parent से होता है, from genetically. यहाँ पे टाइपिंग मिस्टेक होगी, ऑटो करेक्टर जिसको चेंज कर दिया. ओके, इंड्यूस्ड फ्रॉम द इंट्रोड्यूस्ड थ्रू पेरेंट्स. इसमें माइन्यूट क्वांटिटीज आर एनफ, लिटिल बिट इज आल्सो एनफ. So interval of 2 to 3 weeks needed between sensitizing and shocking dose. So first sensitizing dose आ गया, AMI CMI का dose. So between this and the shocking dose, you have 2 to 3 weeks are needed. This is characteristic of anaphylaxis. Once sensitized, it remains so for long time. Shocking dose effective by 4 route, then by IV 4 route नहीं, by intravenous route. Shocking dose मतलब एकदम shock में आ जाता है body. Why? Through your veins, vein में you inject, and then intramuscle, intraperitoneal in your body cavity. Then SC and intradermal. That is through your dermal. Most effective कहाँ से होता है? You don't. This is for medical students. मैं बुक से कॉपी करके पेस्ट किया हूँ, इसीलिए these things, this line is not needed. Most effective by intravenous route. इतना जान लेना. That's all. The shocking antigen must be similar to the sensitizing antigen. The first antigen which enters, it must be same with that of the shocking antigen in anaphylaxis. Then mechanism. Cytotropic IgE, মানে immunoglobulin E. IgE antibodies bound to the surface of mast cells and basophils. They are known as cytotropic basophils. मतलब सेलेर घाड़ेर ऊपर दिए जाए. The IgE antibodies attached to mast cells and basophils. They cause through these antibodies this immune reaction takes place. Then you have this FCER receptors. They are analogous to your T cell receptor. It is present in these cells, in the cytotropic IgE bearing cells, these mast cells and basophils. So far clear?
Yes, sir.
Yes, sir.
ठीक है. Okay. Anaphylaxis in vitro. मतलब बाहर, inside a test tube, this particular anaphylaxis is taking place. So you have the Schultz-Dale phenomenon. What is it? Intestine or uterine muscle strips. They are taken from sensitized guinea pig who are sensitized to an allergen. And they are kept in a bath of Ringer's solution. Ringer's solution is nothing but sodium chloride solution. Saline. Ringer's solution. So that it is alive. Saline is needed for the cell to be alive. And they contract vigorously on addition. They contract vigorously on addition of specific antiserum. The moment you give an antiserum, these muscles, they start to contract immediately. So this is an experiment through which you can see whether this particular compound causes anaphylaxis or not. So you take a particular muscle strip, and then you take your compound which is going to cause your allergy, and immediately when you give it to that muscle starts to contract. Okay. Next, anaphylaxis is primary mediators of anaphylaxis is histamine, serotonin, chemotactic factors. Histamine से सर दर्द होता है. Serotonin, you know, your mood depends on it. Serotonin. So these are all your nerve things. And chemotactics is factors means which cause cell to cell movements. And the secondary mediators are prostaglandins. There are a lot of spelling mistakes which are autocorrection work. These are basically prostaglandins and leukotrienes. I'll make the correction over here. Prostaglandins. Prostaglandins and leukotrienes, platelet activating factors. Others are anaphylactoxins and bradykinin. You know bradykinin, what happens? They increase your water retention in the kidneys. Blood pressure बढ़ा देता है. Then you have the Theobald Smith phenomenon, where guinea pigs sublethal dose of C anemone toxins are given. Guinea pig में you give a sublethal dose of C anemone toxins, and then immunity develops. These are not very much important for your examination purpose, all these phenomena. But the 4 types of hypersensitivity reaction, I have already given you of the hypersensitivity notes which are there already before. पहले दे दिया. Then anaphylactoid reaction. This happens through intravenous trypsin or peptone. You give it through your veins. मतलब blood में injection दे देते हो. Intravenous trypsin or peptone देने से you get this reaction. So here's what happens. Th2 cells, this is mast cells. This is the allergen. Are you able to see this allergen?
Yes, sir.
These are allergens inside mast cells.
Yes, sir.
Against that, you have this Th2 cells, helper 2 cells coming. They are secreting the interleukins, IL2, IL4, IL5, IL13. That is stimulating your B cells. B cells immediately they will start secreting antibodies. These antibodies will bind to the allergen cells, and so many of these chemicals are released, and they will cause severe hypersensitivity or severe allergen reactions. These reactions were not supposed to happen. सबको नहीं होता है, but for some people it happens suddenly. এটা বুঝতে পেরেছো?
Yes, sir.
Yes, sir.
Okay. So what are the type 1 reactions? This is very important. In humans, itching of scalp and tongue, मतलब कभी कभी बैंगन खाने के बाद जीभे चुलकोते आरंभ करे, खुजलाना चालू हो जाता है जीभ के ऊपर में, देन सर खुजलाना चालू हो जाता है सडनली कुछ खाने के बाद. Yes, because of something, suddenly your whole skin starts to itch. Some people have got nausea and vomiting. Prawns खाने के बाद बहुतों को होता है. डेथ भी होता है रेयरली, लेकिन देयर इज लॉस ऑफ कॉन्शियसनेस. कॉजेस सेरम थेरेपी, कुछ सेरम इंजेक्ट किया गया है, उससे यू सडनली यू हैव दिस एनाफाइलैक्टिक रिएक्शन टेकिंग प्लेस. एंटीबायोटिक से किसी को होता है. इंसेक्ट स्टिंग्स, मॉस्किटो, आफ्टर मॉस्किटो बाइट्स क्या होता है, वहां पे स्वेलिंग होता है. देखे हो कभी मॉस्किटो बाइटिंग के बाद?
Yes, sir.
Very good. And that is a type 1 reaction. Next time a mosquito bites you and you get it, yeah, think in your mind, type 1 hypersensitive reaction is taking place. And treatment क्या था? Adrenaline. आजकल there are lots of anti-allergic. Adrenaline 0.5 ml देने से ही immediately it goes down. IC, intramuscular, SC, you don't have to take intramuscular doses. You don't have to think or study about all this, but you know that adrenaline, if you give, then immediately it goes down. You don't need to study much about all the dosage and how do you give it, because you're not a doctor. Basically, this has been taken from a medical textbook, so I have copied and pasted. And therefore, some medical terms are coming inside. But you need to know this very well. Okay. Then there is a cutaneous local anaphylaxis. This follows small intradermal injection. A local will थोड़ा सा फूल जाता है. A flare response is seen. Wheal is basically a central pale area of puffiness. Swelling के लिए थोड़ा सा जगह फूल जाता है मॉस्किटो बाइट की तरह. एंड फ्लेयर वो साइड में रेड हो जाता है. फुल जहां पे फूला है उसके साइड थोड़ा फूलने के सराउंडिंग एरिया बिकम्स फ्लेयर, रेड हो जाता है. दिस इज बेसिकली it is used for testing hypersensitivity. They will take your skin, immediately they'll put the allergen. 10 types of allergen they will put on your skin. And then they will see where there is this little wheel and a flare. Then they will tell you against this particular compound you have got hypersensitivity. Precaution, always you have to keep the adrenaline injection ready for combat. And now what is atopy? This refers to the naturally occurring familial hypersensitivity of human beings. Asthma, hay fever, this is atopy. Atopy का मैं बोला T4 cells का response होता है actually. So antigens involved in atopy can be inhaled. They can be pollen, house dust, they can be eggs, milk, they can be contact allergens. So basically the common allergy, नाक से गिरना चालू हो जाता है, हैचू हैचू चालू हो जाता है एलर्जी. सडनली द डस्ट एंटर्स योर नोज, हैचू हैचू चालू हो जाता है, नाक से पानी गिरना चालू हो जाता है, आंख से पानी गिरना चालू हो जाता है. दैट इज द टाइप 1 hypersensitivity. So diagnosis, you don't basically intra skin injection में they can see वहां पे there is a swelling or known with allergens like pollen, cat or dust mite. चिल्ड्रन 3 इंटू इतना व्हील होता है, एडल्ट 4 into 4 मिलीमीटर व्हील होता है. दिस इज अ पॉजिटिव टेस्ट. देन यू हैव द रेडियो एलर्जो सॉर्बेंट टेस्ट, रैस्ट. So to measure the levels of IgE in serum, to measure the levels of IgE in serum. Naam jaan lo, you don't have to study much in details about this. In diagnosis, one line on diagnosis you have to write. So next day we will talk about cytotoxic type 2 reactions. Okay. So so far type 1 is clear.
Yes, sir.
Okay. Finally type 1 clear.
Yes, sir.
So basically it is the first thing, anaphylaxis atopy hota hai. Short. So do you people have got any questions?
No, sir.
Questions? No questions. Then next day
No, sir.
Thursday হইলো তাহলে, হ্যাঁ বলো বলো.
স্যার ওই যেটা এপিপেন ইউজ করে ওটাই কি ওই অ্যানাফিলাক্সিসের জন্য মানে
কি ইউজ
অ্যানাফাইলাক্সিসের
করে, কি
জন্য
ইউজ করে?
স্যার ইউজ করে এপিপেন
এপি
এপিপেন
এপিপ্যান, হ্যাঁ হ্যাঁ হ্যাঁ
স্যার ওটাই?
হ্যাঁ হ্যাঁ, অনেকের এপিপ্যানেতে প্রবলেম হয়.
ওকে স্যার.
হ্যাঁ, টাইপ 1 হাইপার সেন্সিটিভ নোটটা দিয়ে অনেকদিন আগে দেখেছি, দেখবে একটা আমার পুরোনো নোটটাও রয়েছে. এটা কাজ সকালবেলা বসে বসে বানিয়েছি এই জিনিসটা, তাই জন্য অত কারেকশন গুলো হয়নি, স্পেলিং মিস্টেক প্রচুর হয়েছে. বই থেকে টুকে পেস্ট করছি, কিছু কিছু নিজে লিখেছি. হ্যাঁ, তো কোয়েশ্চেন এখানে আবার কি দেখি কে কার কি লিখেছে. স্যার নো স্যার, আচ্ছা ঠিক আছে, নো কোয়েশ্চেন, আচ্ছা ঠিক আছে, ওকে. তাহলে এটা টাইপ 1টা একটু পড়ে রেখো, না তো ভুলে যাবে, অনেক কিছু আছে. হ্যাঁ,
ওকে
আর
স্যার.
Okay, sir.
পুরোনো নোটটা রয়েছে, দেখো পুরোনো নোট আমার, দেখবে আমার নাম টাম লেখা রয়েছে, এজি নোট বলে লেখা রয়েছে, এই হাইপার সেন্সিটিভিটি. ওটা টাইপ 1টা দেখবে, ওটাতে আমি অনেক ছোট করে দিয়েছি, কনডেন্স করা আছে. হ্যাঁ, তো আজকে একটু ডিটেলসে পড়ানোর চেষ্টা করেছি আমি. আমরা তাহলে আবার থার্সডেতে মিট করবো তো, অফলাইন.
Yes,
ওকে
sir.
স্যার.
আর যারা
Yes, sir.
পারবে না অনলাইন জয়েন করবে,
Okay, sir.
কিন্তু মাঝে সাঝে মাসে একদিন অ্যাটলিস্ট অফলাইন আসার চেষ্টা করো.
ওকে স্যার.
হ্যাঁ স্যার, আসবো আসবো আসবো।
ঠিক আছে ঠিক আছে. আমার নতুন বাড়ি পাশের
স্যার।
বাড়ি.
হ্যাঁ স্যার।
হ্যাঁ, ওটা আমার কিন্তু মাই হাউস, মানে পাঁচওয়ালা ঘর, মানে